Have you ever stopped to wonder why your erections might not be quite as robust as they used to be? A lot of guys just figure it's because of lower testosterone levels or reduced blood flow. And while those things definitely play a role, there's a really important factor that often gets overlooked: the strength of your pelvic floor muscles. These muscles are super important in figuring out how strong, long-lasting, and controllable your erections can be. Think of these muscles kind of like a locking mechanism. They trap blood inside your penis, which helps you keep your erection going strong. But just like the muscles in your arms, legs, or chest, if you don't work them out, they're going to get weaker as you get older. When that happens, your erection aren't as firm. You might start having some trouble with bladder control, and your overall sexual confidence can take a hit. That's where Kegel exercises come in, but with a little twist. Most people mistakenly think that Kegels are only for women, especially after they've had a baby. That's just not the case. In my practice, I've seen men that in their 50s, 60s, and even 70s really improve their performance and confidence by consistently strengthening these muscles that often get ignored. Today, I am going to walk you through 5 of the most effective Kegel-based exercises that you can easily do at home without needing any special equipment. These exercises aren't some kind of trendy fad or a gimmick. They're based on solid science, they've been clinically proven to work, and they're designed to promote stronger erections, improve your bladder health, help you delay ejaculation, and give you more control over your sexual response. Make sure you stick around until the end, because the last exercise is the one that most men tend to skip, but it's a real game changer when it comes to achieving lasting firmness and youthful vitality. Before we get into the exercises, let's cover some important background information. A lot of men are genuinely surprised to learn that the pelvic floor muscles are directly responsible for maintaining strong erections. These are the same muscles that contract when you orgasm, help you control when you pee, and basically keep blood locked inside the erectile tissue. Think of them as your body's built-in support system for erections. When these muscles are weak, blood escapes too quickly, which leads to erections that are softer and don't last as long. However, when they're strong and well coordinated, they act like a clamp, locking in firmness and giving you more conscious control. Unfortunately, modern lifestyles often work against us in this area. Spending hours sitting down, dealing with chronic stress, having bad posture, and not doing exercises that target these muscles all contribute to weakening them. Add the effects of aging to the mix, and you've got a recipe for a decline in performance. The good news is that just like you can lift weights to build your arm muscles, you can train your pelvic floor muscles to restore erectile quality at any age, and you don't have to spend hours at the gym. In fact, just 5 to 10 minutes of focused exercises each day can produce noticeable improvements within a few weeks. To start, lie comfortably on your back, with your knees bent at about a 45-degree angle, your feet positioned hip-width apart, and your arms relaxed at your sides. Take a few deep breaths to settle into the position. Now, tighten your abdominal muscles as if you're drawing your belly button towards your spine. Gently press your lower back into the floor, tilting your pelvis slightly upward. You should feel both your lower abdominal muscles and your deep pelvic floor muscles contracting together. Hold this position for 3 to 5 seconds while breathing steadily, and then release in a controlled manner. This movement might seem simple, but it's surprisingly effective. By engaging the pelvic floor muscles along with the lower abdominal muscles, You're training the precise synergy that's needed to maintain blood flow during arousal. These muscles contract rhythmically during an erection, effectively locking blood in place, acting like a natural restriction ring. This exercise helps you become aware of muscles that most men don't even know they can control. It strengthens the connection between your mind and your muscles, improves your sense of proprioception, awareness of your body's position in space, and improves bladder control by enhancing the coordination of your deep, stabilizing muscles. It can also reduce lower back stress by reinforcing spinal stability. Here's what you should do. Start with 10 to 15 repetitions, holding each tilt for 3 to 5 seconds. Focus on performing the exercise with precision rather than speed. Over the course of several weeks, gradually progress to 20 to 25 repetitions and increase the hold time to as long as 10 seconds. Next, lie face down on the floor with your legs extended and your elbows positioned directly under your shoulders, forearms flat in a sphinx pose. Gently lift your chest, keeping your neck aligned with your spine. Engage your abdominal muscles by drawing your belly button in and lightly contract your pelvic floor muscles as if you're trying to stop the flow of urine midstream. Hold this contraction while breathing deeply. This movement stretches the front of your body, including your hip flexors and abdominal muscles, while simultaneously forcing your pelvic floor and lower abdominal muscles to work together. It's essentially a double-duty exercise that helps you build strength while also increasing flexibility. It also improves blood flow to the pelvic region and enhances endurance by training the muscles to hold a contraction under sustained tension. This creates a stronger connection between brain signals and faster, clearer, and more powerful sexual responses. Here's what you should do for this exercise. Hold the pose for 20 to 30 seconds and repeat 3 to 4 times. Over time, try to progress to holding the pose for 45 to 60 seconds. For the next exercise, get down on your hands and knees on the floor into a tabletop position. Keep your spine straight and your shoulders relaxed. Exhale slowly while drawing your belly button towards your spine. At the same time, contract your pelvic floor muscles as if you're stopping the flow of urine midstream or gently lifting your testicles. Hold this position for 3 to 5 seconds and then release in a controlled manner. This exercise focuses on teaching you how to synchronize your breathing with muscle activation. Your breath is a crucial element that's often overlooked. Contracting on the exhale and relaxing on the inhale helps to improve endurance and conscious control. This exercise, it also strengthens your transverse abdominis, which is like your body's natural weightlifting belt. It improves circulation and erection stability, enhances stamina, and can help delay orgasm by improving your control over these contractions. Here's what you should do. Start with 10 to 15 repetitions and gradually increase the hold time to 7 to 10 seconds over time. As a variation, you can gently shift your weight forward and back for varied engagement. Now, lie on your back with your knees bent, feet positioned hip-width apart, and your arms at your sides. Press your heels into the ground and lift your hips until your body forms a straight line from your shoulders to your knees, holding this bridge position. While in this position, gently push your knees outward as if you're trying to widen the floor, and then return to the center. This is a multi-muscle exercise that works several key areas. It targets your pelvic floor muscles, your glutes, the largest muscles in your body, and your hip adductors. Together, these muscles create pelvic stability, improve circulation, and train your body to maintain firmness, even during movement. This helps improve erection hardness by strengthening blood retention. It also enhances hip mobility and endurance for intimacy, and strengthens your glutes, which reduces back strain during physical activity. Here's what you should do. Start with 8 to 10 repetitions, holding each outward push for 2 to 3 seconds. Over the course of several weeks, gradually increase to 15 to 20 repetitions, or add a resistance band for an extra challenge. For the final exercise, start on your hands and knees on the floor. Widen your knees with your feet facing outwards and lower down to your forearms, keeping your spine straight. Slowly rock your hips forward and back in a gentle rhythmic motion. This movement is unique because it combines a deep stretch of your inner thighs and groin with active engagement of your pelvic floor muscles. Chronic tension in these tissues can create a tourniquet effect that restricts blood flow. The rocking frog stretch helps to release this tension while also training coordinated pelvic activation. This improves blood flow into and retention within the erectile tissue, helping to balance strength with relaxation, which is critical for delaying ejaculation. It can also enhance sensitivity, orgasm intensity, and overall pelvic flexibility. Here's what you should do. Perform this exercise for 30 to 40 seconds per set and repeat 3 times. If the stretch feels too intense, you can modify it by narrowing your knees. When practiced daily, these 5 exercises can create a comprehensive transformation, improving strength, endurance, and awareness. Stronger pelvic floor muscles help to lock in erections, while coordinated muscles sustain firmness for longer. Increased awareness and conscious control allows you to delay orgasm, improve bladder control, and boost your confidence. Clinical studies have shown that men who consistently train their pelvic floor muscles experience a 60 to 80% improvement in erection hardness, achieve significant gains in ejaculation control, and reduce urinary leakage and nighttime urgency. And unlike medications, pumps, or risky surgeries, these results are natural, free of side effects, and permanent with consistent effort. Try to dedicate just 5 to 10 minutes to these exercises each day, and choose a consistent time, such as in the morning or before bed, as these tend to work best for most people. Track your progress by noting changes in hardness, endurance, or bladder control each week. Focus on quality over quantity, because performing the exercises with perfect form matters more than speed. Be patient, as results typically begin to appear within 3 to 4 weeks, with significant improvements after 2 to 3 months. Remember, these exercises aren't just about improving your sexual performance. They also support better posture, provide relief from lower back pain, improve pelvic circulation, enhance core stability, and boost your confidence in everyday life. You're not just building stronger erections, you're building a healthier body and a stronger sense of self. So there you have it, the 5 most powerful Kegel-based exercises for men. These aren't just tricks or quick fixes, they're science-backed methods for retraining your body, restoring firmness, and reclaiming your confidence at any age. Consistency is the key. Invest a few minutes each day and you'll be amazed at the transformation, not just in your sexual performance, but in your overall vitality. If you found this information valuable, please share it with a friend who could benefit from it. And don't forget to subscribe for more evidence-based men's health guidance. Here's to your health, vitality, and confidence at every stage of life. Remember, it's never too late to strengthen your body and reclaim your passion.